Hi, I'm Andy Kapishki, and I will be doing my negative side of the debate in response to Samuel Salazar's affirmative piece of the debate. And I apologize for being late. I didn't really see the notice there, Jim, but here we go. In my opponent's affirmative debate, which should favor the implementation of universal healthcare coverage in the United States, there are several flaws to his lines of reasoning and his two main points, which are affordability and also existing working models. Conclusions can be drawn about the topic of discussion and the position of the speaker, but nowhere in his speech does he directly or explicitly state his claim. There are a lot of facts and statistical figures given by the opponent that are given to showcase the plight of the uninsured throughout the speech, which does well to inform, but only to inform the viewer of how accessibility to healthcare can benefit everyone. There is also no specific claim about the type of universal healthcare system that the United States should adopt, if any, which means that I have a vague set of criterion to dispute from the original argument. However, first I'm going to talk about how there are more advantages to keeping the current system that require no change or institutional overhaul. Second, I'll prove with evidence and reasoning how the claims of affordability and independent working models are not reason enough for the universal healthcare system to be implemented in the United States. So first, my claim is that the current healthcare system should remain in place instead of implementing or creating a universal healthcare system for the United States. In the privatized industry of healthcare and health insurance, the advantage goes to the consumer. Of course, the consumer of healthcare products and services has to be well informed, but the informed consumer can have a better chance of receiving affordable and accessible healthcare in a privatized system as opposed to a universal healthcare system that's government owned and operated. Each U.S. citizen has the right and the freedom to choose whatever healthcare provider he or she wants. This effectively means that you can take your business to a different hospital or a different care center or a different healthcare provider at any time for any reason. So there's a lot of freedom within the privatized healthcare system. Um, this allows for a healthy competition to exist between the businesses of the healthcare industry to drive prices for care and services down. And it's a free market, and the consumer retains the majority of the buying power within the privatized health industry system that we currently hold. Um, According to the Commonwealth Fund in 2013, the United States is ranked first out of 5 well-developed industrialized nations in preventative care, which is a large indication of a successful healthcare system. Also, the U.S. has the edge in healthcare concerning advances in medical technology. And according to Dr. John Howham in an article from March 29, 2014, there are great strides that have been made within the United States healthcare system that are commonly overlooked. From 1900s to from 1900 to 2010, the average life expectancy from birth has increased by 30 years in the United States. And from 1960 up until 2011, mortality rates from heart disease, the number one cause of death in America, has decreased by 56%. So you can see that there are some great strides made within a privatized system. Also, the New York Times chart shows that American doctors are paid the most, which in turn attracts only the most qualified medical professionals in the world, and therefore they can provide the best quality care in the world. Universal healthcare systems that are in place make sure that healthcare is available to all citizens and it's offered at a low financial risk on the part of the individual, or at least that's the general idea. However, there are many issues that arise from such systems. One such issue that does not allow the universal healthcare system to translate well to the United States is the size of the overhaul, or really the size of the population. One of the countries that my opponent highlights as an existing working model is Germany. Now, Germany has a population of almost 82 million people, and this is a population number that is logically much easier to create a universal healthcare system for than setting up an institution to cater to the United States, which has a population of over 4 times that size, according to the census in 2010. My opponent also implies that a smaller national population makes it more difficult to create a public healthcare system that can work effectively, which seems really counterintuitive to me. And my opponent also mentions that costs could be reduced upon implementation of a universal healthcare system simply because it's government owned and operated and they can control costs, ideally lowering the costs for their citizens. Now, in my mind, this is a loose association of reasoning because having the government in control of a public institution does not necessarily mean lower costs of regulation that looks out for people like you and me. The financial aid system is a perfect example of how the government could provide a public service at a low cost, but instead it chooses to exploit the public and their pockets for their ultimate gain. Free national health care can also cause issues with quality and availability of medical procedures and services, like I mentioned earlier. According to healthcareers.com, people in Britain oftentimes forego surgery and other standard procedures and medical operations because hospitals and care centers are full to the brim and have literally no accessibility or availability to see their patients. In many of these cases, patients are actually flying to the United States because they know that the money they pay will get them the medical care that they have deserved. We typically think of Canada as maybe the shining example of a free healthcare system as a nation, but the reality of this public institute is more sobering than we imagine. Um, a Canadian woman in 2010, namely Suzanne Aswan, had to fight against stage 4 colon cancer. The drug that she needed to help her fight the cancer is known as Erbitux, and that's FDA approved. Consequently, the drug is covered by insurance companies in the United States and is listed as a standard treatment. But even in a universal healthcare system like Canada's, the drug was not covered by our health providers. So you can see that the coverage is limited. Even after appeal, she wasn't able to get this drug. But even more troubling than that in Canada is that some waiting lists for major operations are as long as 3 years. And their partners in the United Kingdom sometimes have to wait as long as 6 months to be seen, according to an article by the City Journal in 2013. And to control these costs, what does the government do? If they're in a single payer system or something different than that, if the government's in control, how do they control the costs? Well, simple economics would reason that they have to restrict the healthcare supply. So there's not as many people working, there's not as much accessibility to care. But you know, I would have to say that access to care is more important than affordability of care. But in regards to the affordability argument that my opponent raises, people within the universal healthcare system in Canada actually pay heavily through taxes. The average yearly payment for public healthcare insurance for a Canadian family of 4 is $11,320 in a stat from 2013, according to Nadim Ismail, the Director of Health Policy Studies at the Fraser Institute. And in the same article, Ismail lists that Canadian healthcare systems have a funding gap of $537 billion, which means that they're not able to cover everybody, even though they may be provided with insurance. They can't see all of those patients. And the U.S. would have to tax individuals at a high rate to be able to pull off such a reform here in the States, and that would likely lead to cuts in other government programs such as education and defense, which we cannot afford to abandon as a nation going forward, according to balancepolitics.org. So we can see that the argument for affordability is foiled by the taxes that people within universal public healthcare systems are subjected to. And we can also see that the so-called working models of universal healthcare systems do not offer